Hi.
Bienvenidos.
Welcome to
Moreno Valley
Community Health Center.
Welcome to Moreno Valley Community Health Center.
Riverside University Health System
/ University of California, Riverside
Family Medicine
Residency Program.
Looking forward to seeing you.
My name is Dr. Anashe Almasi. I am a PGY1 Family Medicine resident.
Hi, my name is Truong. I am a PGY3.
Hi, my name is Vijayendra and I'm a PGY2.
Our clinic is a federally qualified health center. We have an in-house laboratory for same-day labs and an in-house pharmacy team to help with questions, prior authorizations, and follow-up patient calls. We have a new behavioral health team that includes a psychiatrist and a therapist. Soon to come are dental services, x-ray, mammogram, DEXA, and ultrasound.
Our clinic has 3 modules, A, B, and C, and we work with the same resident team and nursing team in each module. Each module has 2 color teams, and each color teams has 2 residents from each class, 1 to 2 faculty advisors, and 3 to 4 nurses.
This is an example of a patient room. We have everything you could need for a full history and physical. Because of our color team setup, we are working with the same team of nurses with every clinic. We build very close relationships with the nursing staff and the nursing leadership.
Our patient spectrum ranges from newborn to geriatrics, women's health and prenatal, postpartum, complex care coordination, and much more. We are an extension of the RUHS hospital, which is 10 minutes down the road, so we have close working relationships with many specialists. We have a great group of core faculty that precept patients in the clinic. After seeing the patients and forming an assessment and plan, the resident will review cases with the attending. The program's recent graduates have found jobs in all aspects of family medicine, from full-time hospitalists to outpatient private medicine and everything in between.
Here in the clinic, we are able to perform many common outpatient procedures. Our patients appreciate that they are able to come to get their healthcare maintenance and procedures all in one day.
Our clinic is an integral part of the community, and we are building partnerships with many organizations. Riverside County is the 4th largest county in California and extends from Orange County to the border of Arizona.
It also focuses on a lot of wellness. We work hard, and we also want to take care of our residents as well. We have a balanced group, resident bonding, and other informal activities to support our residents.
This is where we have lectures every Thursday afternoon. Every resident has protected time to attend unless they are on call for family medicine. Speaking of inpatient medicine, coffee is very vital, and we have an endless supply. Our schedule is very inpatient heavy during the first year and becomes more outpatient heavy during second and third year.
This is a computer workspace area, which has been crucial during the COVID-19 pandemic, as our Riverside County Emergency Operations Center has depended on our residents to contact and educate the patients. We are very proud of our residency workforce, who have had to adjust quickly to new learning circumstances in the clinic and the hospital.
Continuity of care is very important to our residents, both for learning opportunities and for overall wellness. This is why we are in family medicine after all.
We also have faculty members who are specialty trained, including sports, geriatrics, and palliative medicine, and still practice full-spectrum family medicine. Our program has an associated sports medicine fellowship, and residents are always excited to go back to high school and staff football games.
Thank you for joining us on this virtual tour of the Moreno Valley Community Health Center and learning more about Riverside University Health System Family Medicine Residency.